Hello, welcome to the Senior Rehab Project, the podcast for the community of rehab clinicians working to advance care for older adults. I'm your host, Erin Carey. I'm here with Tali Spaisman, and this is the SR Prereq segment, where the evidence-based conversations keep you up to date. So in today's episode, we will discuss a 2017 systematic review about strength training in Parkinson's disease. But before we jump into today's episode, I want to mention our sponsor, the Academy of Geriatric Physical Therapy. The AGPT works hard to provide us Geri PTs with high quality content to help us advance our practice. This year's Combined Sections meeting is a great example of that. The AGPT is offering 3 pre-conference courses in DC before CSM kicks off. This year, you can learn about the fundamentals of Tai Chi, how to apply a comprehensive approach to successful aging, or how to effectively manage kyphosis. To learn more about these course offerings and how you can sign up, go to geriatricspt.org/SRP. And on to today's episode. Tali, how are you doing today?
I'm good. How are you doing, Erin?
I'm great. It's really nice to hear your voice.
It's really nice to hear your voice too and to see you like we're doing it via Zoom. So it's nice seeing you.
Yeah. So today we're going to talk about an article entitled Systematic Review on Strength Training in Parkinson's Disease, an Unsolved Question. So the authors of this are 3 Italian researchers, of whom I couldn't really find any information because it was all in Italian.
Mm-hmm. Oh,
yeah.
Okay.
So the Google Translate wasn't super helpful either, but that's okay. So it was published in Clinical Interventions in Aging in March 2017, and the impact factor of this journal is 2.651. And I think we'll just go right for the introduction if you're ready. Any questions before we get going?
No, I'm pumped about this.
Did
you see what I did there?
Yes.
Because I do see a lot of not only PTs but personal trainers in gyms working with people with Parkinson's. So I'm excited to know what the evidence say about that.
Same. Like I've had a couple of patients where they have Parkinson's disease and like we have the things like the LSVT big, which has some pretty good evidence, but I'm curious about things like strength training.
Yeah. We either do things and use methods that are like mediocrely proven or not proven at all. Not at all, but do not have like great validity and reliability. Or we don't use things that have great evidence or that we know work, but we just don't use it because either it's too much trouble but I feel like it's nice to examine something that we use. Does it actually work?
Yeah, definitely. I think about the sort of interventions I tend to fall back on. And there are things that are more familiar and that I feel more comfortable with. Yeah, I don't branch out as much and maybe we should. So ready for introduction?
Okay, I am ready.
So in the introduction, they start with a definition and description of the cardinal symptoms of Parkinson's disease, including tremors, rigidity, and impaired posture or balance. Additional symptoms that they suggest may include things like sleep disorders and GI dysfunction. Then they talk about the pathogenesis of Parkinson's disease, stating Lewy bodies/neurites emerge in the substantia nigra pars compacta, as well as the spinal cord and peripheral nervous system that I actually didn't know. I thought it was just all substantia nigra pars compacta. But this causes cell membrane disruption, oxidative stress, and the misfolding of proteins, aka bad news. So they don't really know where it comes from. The evidence suggests that it's some combination of environmental and genetic factors. So the treatment for Parkinson's disease pharmacologically is levodopa, dopamine agonists, and some other things, but these only slow down the progression of Parkinson's disease. They do not stop it. So these are not curative treatments. They are symptomatic treatments. I think that's what it's called.
Yeah.
Non-pharmacological treatment includes physical activity. So this can help improve the management of symptoms, delay the disease progression, and improve physiological and structural function of the brain. There's strong evidence that physical activity can help these things in patients with Parkinson's disease.
Did they go specifically which symptoms physical activity helps with?
Not in this review.
But
they have their resources.
Okay.
I didn't look into the primary literature on that, so.
Okay.
Yeah. Good question, though. They don't know if physical activity affects brain neuroplasticity, and we do know that it cannot reverse the progression of the disease.
it's really important to say that and manage expectations with patients. Some people, especially families, I don't see it from patients anymore, but families of patients that come and say, oh, he exercises so much, how come the Parkinson's is still there? And it's really important to manage the expectation that yes, it's going to slow down the deterioration of balance. It's gonna like keep functionality for a longer time, but it's not going to cure Parkinson's.
Right. Yeah. And then they'll say things like, well, I read about this thing online that cures Parkinson's for this one person and this blah, blah, blah. And it's like, please stop. As of right now, today, whatever today's date is, December 2nd, 2018, there is no cure for Parkinson's disease.
First night of Hanukkah.
This year for Hanukkah, I'd like Parkinson's disease to be cured. Although by the time this comes out, so if that changes between then and now, I will update this recording.
It would be great Christmas.
Yeah. Merry Christmas. Parkinson's is cured. However, I will not hold out. I will not hold my breath. It's probably not going to happen.
Yes. Okay.
Yeah. So then there are a fair number of recent reviews published about the beneficial effects of aerobic exercise in Parkinson's disease progression, but there's none, I guess, until this was published about strength training specifically, hence this review. So I'm just going to read a quote about the primary and secondary outcomes of this review. It's directly, I forgot to say, this manuscript was open source. There will be a link to it in the show notes. So cool. This is directly from the open source article, so it's okay to read this on the air. The primary outcome of this review was to assess the effectiveness of resistance training on muscle strength improvement. The secondary outcome was to shed light on the effects of resistance training in improving physical performance and quality of life of patients with Parkinson's disease. That's it for the intro. Any questions?
No, it was an intro.
My husband just sent me a message saying, you mean open access, not open source. Thanks, honey. Andrew just said no problem. All right, okay. On to the methods. These authors followed the PRISMA guidelines. If you're curious about what those entail, there's an episode somewhere in the archives where Tali and I talk about it. So they searched PubMed, Pedro, Cochrane Central Register of Controlled Trials, Scopus, and Web of Science. Their terms, they seemed appropriate. They're like Parkinson's disease and blah, 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 strength training. It's fine. They seemed fine. They also looked at gray literature using the same search terms in Google and Google Scholar, which I'm really glad, Tali, you and I talked about what gray literature was. If you want to give the listeners a quick recap of what that is, that'd be great.
Gray literature is articles and research that are not published in journals. They are like postdocs or doctoral students that have done their research and it was not published yet, or like it's still good, and I think it's still really good research and something that you should look into. Things that were presented in conferences like CSM, that you know how there's sometimes those really cool posters that are presented. So the poster has research behind it.
Yes, it does.
The research behind it, if it was not published, is gray literature.
Nailed it.
Anything
Perfect.
you want to? Yeah.
Nope, that was exactly what I wanted. Thank you.
Okay.
All right. So they looked at articles until February 2016. They didn't provide a start date, which I thought was kind of weird, but whatever. They can do what they want. So the selection criteria, they define strength training as an intervention in which participants exercised a muscle or group of muscles against an external resistance. So they included resistive cycle ergometry, quote unquote weight machines, elastic bands, a punching bag, and water.
Yeah. Speaking of punching bags, sorry, I had a joke there. But speaking of punching bags, boxing was one of the things that I read a few years ago that was recommended for people with Parkinson's for coordination and more control of tremor.
Yeah, and they talk about it a little bit later in the results as well.
Cool.
Yeah. So I thought the resistive cycle ergometry Like, I'm not super married to that as a strength exercise. Like, I get it. You get stronger, but I think of it as more of an aerobic capacity, functional activity tolerance thing. But I guess, I mean, if you increase the weight or increase the resistance on the cycle ergometer, sure. But I'm still kind of like, about it.
Mm-hmm. No, I agree.
Yeah.
Nothing to say more than that. I personally, I think it's my own bias. I think it's boring. I don't like I would use it for people that cannot, uh, that need aerobics but cannot do lower limb activity. But I find it kind of boring.
Yep.
That's all.
Well, we have equipment. I work in a skilled nursing facility now. We have equipment that you can play games on it. So like you're a car driving in traffic, or like you're a goalie in soccer going back and forth. So that makes it a little less boring.
Okay, no, that I would definitely give a try.
Yeah.
But the ones that you just put on a table in
Have
front
fun.
of them and say, all right, I'll be back in 20 minutes.
Yeah. Woof. All right. So then they evaluated the quality of the strength training literature. So they looked at RCTs that included men and women, people who are stages 1 through 3 on the Hone and Yar scale of Parkinson's disease severity, looking at strength training versus different exercise protocol. So they call that like later traditional physiotherapy and whatever. Vague. I get it. They looked at studies that looked at outcomes including muscle strength, physical performance, and quality of life, which makes sense considering the purpose and the primary and secondary outcomes.
What were the primary and secondary outcomes?
The primary outcome was to assess the effectiveness of resistance training on muscle strength improvement.
Uh-huh.
The secondary outcome was the same thing on physical performance and quality of life.
Oh, okay, because I didn't catch the secondary.
That's okay. What I like about this is they were very specific in that they only wanted articles that did the training and assessment during the on period of medication. So like a patient with Parkinson's disease in an off period is going to score lower. And when they're on, they're going to score higher. Like that's just how it works. And they could potentially skew their data that way.
Okay, good. It's one of the problems with research about Parkinson's that you don't really know when people are, you know how big the difference is between on and off, to the fact that sometimes I had a student once that was walking with me when we saw the same patient day after day, and one time it was on and the first time it was off. And the second time it was on, and the student didn't recognize him.
Yep.
And I said, that's why we check the wristbands.
Oh, there you go.
All right.
Cool. And they also included studies in English. So the exclusion criteria were that they didn't want observational studies. They didn't want to look at studies with healthy or non-exercise controls. So they're comparing patients with Parkinson's disease with patients with Parkinson's disease. Studies with a supplementary intervention with the strength training, which I'm cool with, makes sense. And then studies with tailored exercise programs to meet individual capacity. Like, I guess I get it. It helps the cohort be more homogenous, but like everything is adapted to the patient, It was just kind of like an odd phrase.
Okay.
Yeah.
All right.
So then first the authors, there are two authors that screened the title, then the abstract, and then if there were any discrepancies, they looked at the full text, and discrepancies ends up resolved through discussion, because of course they were. So then, unfortunately, none of the gray literature made it past the initial screening process. I know. I'm sorry. They tried.
No.
They gave it a go.
At least, you know what? At least they gave it a try. And it is sometimes there is a reason that the gray literature doesn't get published.
Yes.
Because like either the methods are not secure enough, but I'm glad they at least tried. So.
Yeah.
Kudos.
Good work, authors. All right. So then data extraction, the things that they took out of the data were the disease population, the disease status. So that's that Hone and Yar scale. the study design, the number of participants, the strength training specifics, including duration, frequency, intensity, and specific exercises, which I appreciate. And then any discrepancies were resolved through discussion. It's fine. So then there was an assessment of bias via the Pedro principles, and these studies were included if the Pedro score was greater than 6, which I like a lot. So that means they have a very low risk of bias, or a low risk of bias. So that's pretty much it for the methods. It seems pretty cut and dry, pretty typical for methods, minus the things about discussion and the vague wording of some of the methods that they used.
Okay. No, sounds good. So far, I'm okay with it.
Cool. All right, on to the results.
Yay.
So they started out with 12,110 articles, and they went down to 13. The poor grad students that had to deal with that.
I wish people, the poor grad students.
Yeah. There are a lot of duplicates. Oh, 2 of the articles shared data sets, so they counted that as 1, by the way.
Oh, okay. All right.
So 13.
So that's 2 out of the 13
Check.
hundreds.
Yeah. 12,000.
Sorry.
It's okay. All right. So then the populations, the lowest mean age was 58.6, plus or minus 5.6. The highest was 75.7, plus or minus 7.2. So comfortably in the older adult range.
Mm-hmm.
The subject numbers range from 22 participants to 60. The intervention time period ranged from a single session, and then approximately a week to 2 years. So that and then that's okay. So most articles assessed post-treatment effects. 3 of them looked at long-term effects, and most studies used the cycle ergometer, water, weight machines. Like, I hate that. Weight machines.
Yeah, can I ask a question? Did they specify a little bit why so many were not included?
They did, and I don't know. I didn't really write it down. They have a really nice figure as per the PRISMA guidelines of like why there were a bunch that were excluded.
Okay.
So weight machines, elastic bands, cuff weights, and then a few did the punching bag, therapy, and water. So
therapy, okay.
Therapy. So that one treatment session, that 15-minute treatment session was upper extremity therapy, and we'll talk about that later. Anyway. So one study did upper extremities and lower extremities, and they did a percentage of a 1 rep max ranging from 40 to 70 to 80% of 1 rep max for lower, and then from 30 to 80 as well for the upper limbs. So at least one of the studies specified in terms of 1 rep max or percentage of 1 rep max. So the increased intensity varied between the studies, which fine. Okay. So then looking at the primary outcome of muscle strength, 6 of these 13 studies assessed muscle strength. 3 were measured via isometric contraction. So that's like with one of those little handheld thingies that you put it against the patient's limb and you're like, kick me. And they kick as hard as they can.
Like a handheld dynamometer?
Exactly. Yes. Thank you, Tali. So we assume it was by handheld dynamometer because that just makes the most sense. 1 was via measuring the maximum voluntary contraction and rate of force development, which I assume was with, what are those big machines? It was with one of those machines. What are they called, Tali?
Well, it's a Biodex. But
yes.
That's the company. I want like I have somewhere the name of like the machine, like of what it is. Like
everything I see says isokinetic dynamometer.
Yeah, that's what it is.
Yeah. Biodex is easier to say.
Yes, but it's like how Kleenex is not all tissues, it's just the one that you say and they mean a Kleenex.
Exactly. It's the same sort of thing, and that's fine until there's a good competitor out there that I know about. I'm just going to keep saying Biodex.
Okay, so, but just to make it clear, it's an isokinetic dynamometer.
Yeah, I'm okay with that. Yes. So then one of the studies looked at peak muscle power, 1 looked at hand grip, pinch strength, and other tests without instrumental evaluation specifically. I don't know how they did 1 hand grip without instrumental evaluation. Regardless, So then 2 of the studies with weight machines showed statistically significant improvement in strength compared to controls. One showed dexterity improvement after single exercise session with therapy. One study showed that strength training in treadmill groups improved, showing statistic significance, but there was no between group differences. So they exercised and they were better in their strength. One study showed improvement in strength and control, but not statistically significant. And then they made the point of the meta-analysis isn't possible with this study due to the heterogeneity of the data. So like not super strong increase in muscle strength with specifically weight training, but some show it. So then the secondary outcomes included balance. So they used things like the Berg Balance Scale, the Activity-Specific Balance Confidence Scale, single leg stance time, center of mass displacement, a bunch of other ones. And most studies showed an improvement in balance regardless of intervention. So another one like strength training is great, but it like isn't as better or worse than anything else. And 2 studies showed the control groups had an improvement in balance over the intervention groups, and that was the boxing. And there was repetitive step group training as well. But like the control group of like typical PT showed a greater improvement in balance than boxing.
Great. So regular PT, what did it include inside it?
So there was one study that looked at boxing compared to regular PT.
Yeah.
And the regular PT ended up doing better in their balance score.
Yeah, but what does regular PT mean? Do you remember? I don't
know. They didn't define it either, but it's like the comparison between the 2.
I assume the typical PT did involve strengthening and like doing a lot of the 4 square step tests, but as a training.
Yeah.
But I cannot assume that because it was not told.
Right. Can't make any assumptions. Yeah. So then...
I mean, I can, but they would be wrong.
Yeah, don't be wrong. Being wrong is not allowed here. This is a wrong-free zone.
It's all the righteousness.
Yeah. Hydrotherapy showed a statistically significant difference in balance between groups. So,
ooh.
Yeah.
Yes.
Yeah, so that's good. As far as gait is concerned, 6 studies evaluated gait patterns, 3 reported improvement, but none of them were statistically significant. And then there were no differences in freezing of gait there's a freezing of gait outcome measure as well. There was one study that looked at aerobic performance measured by the 2-minute step test. The aerobic performance in patients with Parkinson's disease improved the strength and treadmill training compared to traditional PT. Weight machines, whatever. Traditional PT.
Again, the problem is that all of those things are maybe not boxing. Well,
Yeah.
Maybe it is too. Like like treadmill is included in traditional PT, so I don't know what they mean.
Yeah, I think it would be worthwhile to go to the source material and kind of see what they meant as regular PT. Because it probably varies study by study as well, because these are from all over the place.
Fine.
They also noted that treadmill training improved flexibility. Cool. I thought that was, I don't know how.
It is nice.
It's nice, but for flexibility?
Why not?
Because you don't push the limits of the range of motion of much things unless you're like doing weird treadmill training where you're like hopping and skipping and like, I don't know, doing those side things people do at the gym. Maybe.
Like the Minister of Silly Walk?
Yes. If they're doing a treadmill training exercise protocol on the Ministry of Silly Walks, then I could believe it. However.
No, I'll tell you how it's my theory of how it helps, but
let's hear it.
It needs to be checked. The problem with flexibility is usually not muscle length. It's usually the hyper shooting of muscle spindle and other neurons and receptors.
That's your theory, or that's what you know to be true?
No, I'll start over. A lot of times, the problem in flexibility is not the actual length. Like if you will take a cadaver and check the hamstrings between one cadaver to another, they could be the same length. But it could be when those two cadavers were alive and people. One
when they were people.
when they were. I sound like an awful human being.
Nailed it.
When they're alive, it could be that one of them did have what we call short hamstrings, but it was not due to the length, it was due to the nervous system. And, it's how some people don't relax, as we say.
I see.
So I can see how when training about walking, it could reduce the rigidity, which could reduce the, which could reduce how unflexible somebody is.
Okay, that's a really good explanation. Thank you. Because I was like, that's dumb. I'm walking away from this. Ha ha. But shiz. Yeah.
But
yes. But that's really helpful. Thank you, Tali.
No problem.
Another secondary outcome measure for physical performance was through the Unified Parkinson's Disease Rating Scale Part 3. There was improvement noted, but no statistical significance. So then the ways that they measured physical performance were usually the TUG, the 6-minute walk test, or the 10-meter walk test. All the groups engaging in any form of exercise showed improvement. Only one study showed improvement in the strength training group compared to controls. On to quality of life parameters, which was a secondary outcome. The measures they used was that same Parkinson's disease rating scale, but it was part 2. So I guess it's like in different parts looking at different things. They used the Parkinson's disease questionnaire, Parkinson's disease quality of life scale, and the Beck depression inventory. So 2 studies showed no changes in quality of life in strength training. 4 studies noted improvement. 2 of those studies was statistically significant of the strength training group compared to controls. So like the strongest bit of evidence for strength training in helping patients with Parkinson's disease seems to be in their quality of life. And I kind of wonder why, if it's maybe the community aspect of it, or they feel much more capable, or it's just like, I don't know. I'm curious about why that is the way it is. And this article didn't really go into that.
I don't know if you remember that we talked about almost a year ago or a little more, we talked about how strength training helps with self-efficacy in older adults.
That sounds familiar.
So, and I do think that when people feel like they can, like people like have that self-efficacy, and then their quality of life improve, because it's not that scary to be alone at home, like to sleep alone at night, because they feel like, what, I know exactly what to do if I'm strong enough to crawl to the phone and call somebody. Or
yeah, that's a good point. Okay, that also makes perfect sense.
So and strength training, it helps with a lot of. There have been some research about at-risk youth and children, that strength training really helps with their ability to believe that they can overcome things.
Yeah, that makes sense to me.
So maybe it's the same with older adults.
With Parkinson's disease, maybe.
Mm-hmm.
Maybe strength training is just awesome.
It is. You know what? It's like, it's kind of it's kind of a baller move to know that, yes, I have Parkinson's, but hey, I can deadlift.
Right, exactly. Or like, I benched this much today and I'm a 90-pound lady with Parkinson's. Like, how cool.
Yeah.
That makes sense. Cool. Another illuminating thought by Tali.
I think it's the holiday.
It's the Hanukkah. Happy Hanukkah!
Illuminating, it's like.
Oh, okay. That's pretty much it for the results. Any questions? Any thoughts, feelings beyond what we've already discussed?
No, I think that I spoke all my thoughts. I shared my feelings.
Good. All right. So on to the discussion. First, they talk about the strengths and the limitations. So the strengths, they said, were the selective criteria for the articles and the high quality articles that they found. The limitations, they didn't answer the question that they went out to answer about motor symptom improvement or strength training, and they couldn't do a meta-analysis. I think that's great. I think they're right. So then they gave a summary of findings that I'm just going to read and then add my 2 cents. So, strength training performed against a resistance different from body weight is well tolerated in subjects with mild to moderate Parkinson's disease. So, basically, it doesn't hurt. There were no reported injuries, but they didn't actually mention injuries or that they even looked at injuries in the data extraction section. So, I kind of wish they had, just because, like, they're just kind of pulling a conclusion out and they're like, oh, and no one got hurt. Just, it seems like it was pulled out of thin air, whatever.
Yeah, like they didn't really, like, it was like, oh yeah, nobody said anything. So
Yeah. Like in the beginning, if they had said, we want to see if it's safe, that would be great.
Okay.
So then the second point they made, strength training improves both physical parameters and quality of life parameters in patients with Parkinson's disease. I would add the word may because the data seems to be conflicting.
Okay.
So to support the beneficial effects of strength training, clinical trials that include specific muscle strength evaluation are required. Remember, only 6 out of the 13 studies actually looked at muscle strength. So of those 6, results weren't that conclusive. So conclusions, there were positive results in most studies, improving quality of life and physical parameters. And I'm just going to read you bits from the conclusion, and then that'll pretty much be it for the article. Importantly, strength training did not determine a decline in most of the outcomes considered with respect to the other training. Nevertheless, the effect of strength training on balance is uncertain because, on the basis of the items included, data are conflicting. Despite the encouraging results, our review highlighted the lack of common intent in terms of strength training, control group training, intervention design, and outcomes. Accordingly, further studies are necessary to support the beneficial effects of different types of strength training in Parkinson's disease subjects and to underline the superiority of strength training in people with Parkinson's with respect to other training. That's pretty much it. I can talk a little bit about the tables and figures if you want. They're actually I think they're super helpful.
I will take a look at the tables later, unless there's something that translates well to the spoken word.
Well, I think it's worthwhile to know what the tables are because the details of the tables are actually pretty helpful.
Okay.
So the first is the study selection graphic as per PRISMA guidelines. It's whatever. Don't waste your time. Table 1 is the pager scores of all the studies with the specific assessment.
That's nice.
Yeah. Table 2 is the details of intervention type and outcomes of the articles reviewed. That one's pretty helpful. And then table 3 is details of strength training of the articles reviewed. And that one's especially helpful. It talks about mode and measures that they use in the populations.
Okay.
I thought those were helpful. If you feel like looking at them, do it. They're cool. So that's pretty much it on the article. Any thoughts, feelings before I go to the outro?
No?
Nope.
No, I'm just kidding. No, I thank you for bringing this study, even though it's, inconclusive.
Yeah, but I think it highlights some important things about what we know about persons with Parkinson's disease and strength training, which is we don't know a lot unless we use weight machines or water.
Yeah. I kind of have a few things that I take from this article.
Go.
We need to market ourselves better because traditional PT,
whatever that is.
Oh, I have no idea what traditional PT is.
Like, we're PTs and we don't know what that is.
Yeah. But it is definitely something that I want to look at more than just this study.
Sure.
Yeah, and it's nice to know if we should focus on strength or should we do things that are more about coordination and balance and gait. Do we want to do, I don't know, PNF? So it's research should lead to us making the most of our time in the clinic.
Yeah, like it should inspire us to try something that we wouldn't have tried before, but, within the confines of what's available to us. Like, the resistance training that they talk about in this article isn't really specific. And I just wonder if different types of resistive training could be really helpful. Like, like Olympic style lifting versus dumbbell curls versus whatever.
Okay. Thank you very much, Erin.
Yeah, thank you all for listening to the Senior Rehab Project. If you have gained from this episode, consider supporting our work. You can become a patron through Patreon, a service that allows people like you to support people like us. You can give as little as $1 a month or become a game changer for $8.99 a month, where you'll get an awesome Redefine Old mug and access to our monthly meetups. Just go to seniorrehabproject.com to learn more and find the show notes for this episode. Don't forget to enjoy the rest of your day.